I'm Dr. Charles Denham. I'm chairman of TMIT Global and co-founder of the MedTech Bystander Rescue Care Program. Now, as our country is attempting to recover from the COVID crisis, deaths have topped 600,000, and we must battle the surge of variants. We have three great opportunities to save lives. Immediately during local outbreaks, along the full reopening bridge, and once we all get to the new normal. We've come a long way, but we have a long way to go. First off, we have to thank our now more than 100 subject matter experts and community leaders on our rapid response team, and the world-class experts who contributed to our 2 Discovery Channel films and leadership training programs whose messages had great impact. We also have to thank the world-class medical centers and organizations who participated in our multi-institutional study of more than 1,000 family responses addressing readiness, response, rescue, recovery, and resilience during the crisis. Finally, we're very thankful for the college students, alumni, and faculty of leading universities serving through our Global Student Outreach Program that is driving safety through networks of teens and young adults. Our Coronavirus Care Community of Practice is a rapid response initiative built on the existing platform of our MedTech Bystander Rescue Care Program we started in 2015 at major medical centers, schools, and in communities. MedTech fuses the best medical emergency practice with tactical action. When the coronavirus crisis hit, we convened a rapid response team from our pool of national subject matter experts. We originally sought to meet a vital need, helping the essential critical infrastructure workers in 16 industry sectors designated by Homeland Security. Those who care for us, keep us safe, and keep the food, water, and power flowing to our homes. Those who have to go to work no matter what. They were the most vulnerable, and there were no safety training resources for them and their families. Then the program expanded to the general public when we realized we were meeting a critical need of all families. In August of 2020, all educators were declared to be essential critical workers by Homeland Security, and we added our work for them to our programs. On behalf of this team, I invite you to join our community of practice. It is an ongoing learning community producing live monthly webinars, mobile-friendly courses, and tools you need to take care of your families. We came through an enormous surge of infections and deaths at the turn of the year. We're now facing the Delta variant surge with exploding infections in the unvaccinated populations. And although they are much more protected, there are breakthrough infections in those who have been vaccinated. So what have we learned for the next surge or pandemic? The good news, and even the great news, is that the very families that are our weakest link can become our greatest strength. Now that we know that family infection transmission chains are our Achilles heel, we can break them by direct actions at the source, at the family and roommate behavior level. This can turn the tide of the next surges in a matter of weeks. It can be done. The CDC, state, and county public health guidelines change almost on a daily basis with the science. That's why every family needs an evolving family safety plan to convert the science to safety. The CDC tells the public the what to do, which is terrific. We teach them the how, the actions they can take to turn the science into safety for their families and friends. Our Survive and Thrive series of courses have helped families come home safe, assess their threats and vulnerabilities to keep their kids safe, create family safety plans, know how to use family plan templates, know how to care for loved ones at home, learn how to update the family plan along with the evolving science, learn emergency rescue skills, know what to do when loved ones are in the ICU, understand vaccines and variants, learn about COVID long hauler conditions, identify the best practices on the road to victory, and learn what will be important to keep our families safe from emergencies at the new normal when we're through the crisis. We invite you to attend our free monthly webinars, online demand training, and take our training certificate courses for professionals and families. We have programs for all faiths, medical and security volunteers, and we're developing Survive and Thrive guides to help educators and schools as they seek to overcome social distance challenges to keep their students safe. Learn about service opportunities for scouts, teams, and local membership organizations. The Coronavirus Care Community of Practice is not a standalone initiative. We developed our MedTech Bystander Rescue Care program 5 years ago to teach the public how to save lives in those 10 minutes before professional first responders arrive. Failure to rescue has been our fight. Now being piloted in 5 states, we tackled the leading causes of preventable death and teach what anyone in the public can do to save lives in those first precious minutes when so many lives can be saved. CPR and use of automated external defibrillators for sudden cardiac arrest, the Heimlich maneuver for choking and water rescue for drowning, care of opioid overdose with the use of reversal agents like Narcan, EpiPen use for life-threatening allergic reactions to food, medicines, and insect bites, bleeding control for active shooter events and major trauma, infection prevention and care, non-traffic related run-over transportation accidents, and bullying, which can lead to harm and even death. Now, harm from the coronavirus crisis has jumped to the top of the list and has impacted the care for all of these emergency conditions. We were not surprised that our programs were well received by professional first responders, caregivers, and their families. However, a big surprise was that our program for essential worker families hit a nerve with the general public, who sought to be trained with them. This dramatically expanded our reach. This is a list of our progress since March of 2020. If you wish to take advantage of any of our programs, please go to www.medtechglobal.org, where you can review our progress report video and tap the resources to help you, your family, and your community. The care of our communities is absolutely critical. Thank you for all you're doing to protect those at risk and those who are most vulnerable. As we say to all of our MedTech rescue teams, we have to fight the good fight, finish the race, and keep the faith. Everyone is a patient, and everyone can be a caregiver.